Welcome in today's nursing webinar quiz session. Myself Shanti, and we are going to have the quiz on the previous Delta topic, that is on surgical oncology nursing. And for this, we have Ms. Surabhi, who is from Nursing Education and Training Department. I welcome you, Surabhi. Please unmute yourself. Yes.
Thank you, ma'am.
Yes.
Thank you, ma'am, for giving me this opportunity.
You're welcome. Just a minute. And I like to repeat the game rules, like everybody, participants who are logging in, they'll have to enter the game pin number, which is 502-5137. Facebook users should, answer by using the options and type your comments in the comment box. And those who do not have Facebook, please, now also there is still time, you can download the Kaho tab and start playing. So over to you, Survi, for the rest of the session. Yes.
Thank you, ma'am. Hello, good afternoon, everyone. Myself, Surabhi, nurse educator. Oh, I can see how many members have joined already. Sangita, Kavya, Pinky. Who is this SBP? Sanjana, Kartika, Saujanya, Nitu, Shravani, Mickey, Soumya. Who is this Chupki? Vanilla, Sushmita, Pinky, so many members have joined. Here also I would like to repeat 5025137 is your game pin. So we are good to go to start Nursing Pro Quiz, Surgical Oncology, 15th Nursing Pro Quiz. Welcome to all the participants. So are you up for the challenge? Here there is a secret to win your game. Eliminate the wrong answers first, secret the right options, check for multi-selects and double points, and most vital, first is finger first. So 15th Nursing Pro Quiz on. We have 3 rounds. One is end of life, which is palliative care. Round 2, surgical aspects of breast cancer. Round 3, pivotal role of brachytherapy in cervical cancer. Are you ready to go? Round 1, end of life for palliative care. When is your palliative care necessary? Option A, advanced cancer. Option B, chronic illnesses. Option C, acute heart failure. Option D, infectious disease, whether HIV or AIDS. Oh, I can see this is a really overwhelming response. 22 members have already answered. So, what are you thinking? Which is the right answer? Those who are watching on Facebook, please do comment in the comment box. Yes, we can see there are 24 members who has given the right answer, that is advanced cancer. Oh, Queen, who is this Queen who is in the top list? Then Tiger, Maheshwari, Merlin, Sony, who are in the top list. Then we can see the answer here, advanced cancer, because the disease is no longer responsive to curative treatment such as advanced cancer. Because of that, your palliative care is at most vital. Now we will see who is the multi-select questions. What are the key components of quality palliative care? Option A, patient and family preparedness. Option B, management of pain and symptoms. Option C, comfort and dignity. Option D, all of the above. What are you thinking? What is the correct answer? We can see here 17, 18 members have answered. Your time is running up. 8, 6, 5, 4, 3, 2, 1. Your time up. Here is the correct answer. We can see 35 members have already answered. All of the above is the answer. So now Tiger is coming off. Queen is again in the second list. So here is answer is all of the above, because all of the above components are also important for your palliative care. So here is the question number 3. Should patient preferences be taken into account for DNR or DNI? Option A, yes. Option B, no. Option C, optional. Option D, patient's next of kin can decide.
And the
Yes,
DNI
Arya.
do not intubate.
Yes. 54 members has already answered. Yes, here is the correct answer. 16 members have already answered it. Patients next. So again, Queen is coming up. Tiger again going to the second situation. So here is a rational. Patient's next of kin can decide. If patient is conscious, can be involved in decision making. Otherwise, next of kins can be decided. Here you are having a double point. Be careful. What are the key considerations for managing pain in palliative care? Option A, strong opioids. Option B, moderate to severe non-opioids. Option C, simple analgesics. Option D, all of the above. I can see here 28, 29, 32 members have already answered. Your time also running out. Please, fastest finger first. Those who are also watching in Facebook can do comment in the comment box. Here is the correct answer. We have got it. All of the above. Already 27 members have answered. Here again, Queen is the top list. Who is this Queen? Jungle Queen. Here is your answer, all of the above, because analgesic administered is for the condition of the patient. Always we follow that.
So Surbi, she must be from jungle, playing from
Yes,
jungle. Yes.
might be, ma'am.
Yeah.
So here is our round two, surgical aspects of breast cancer. Question number 5, what is the most common type of cancer among women? Option A, skin cancer. Option B, cervical cancer. Option C, breast cancer. Option D, ovarian cancer. Women, please answer. 43, 44 have answered already. 4, 3, 2, 1. Time up. Here we got the correct answers. 47 have already answered, that is breast cancer. Again, Jungle Queen is in the top list. Tiger is following, not holding his position. Breast cancer is the most common cancer indeed globally as per World Health Organization. Next question is here, what is breast cancer? Option A, growth of abnormal breast cells. Option B, mutation of BRCA1 and BRCA2, which are the human genes. Number C, hereditary. Option D is all of the above. Already 53 members have answered. Wow, your time is off. Here we can see the answers. Only 5 members have answers. This is mutation in BRCA1 and BRCA2. What are the Jungle Queen again in the top list. Tiger is holding his position also. So here is the rational mutation in these genes can increase the risk of developing breast cancer. Here the next question for you, which is multi-select. You can select more than one. What are the recommended early detection and screening protocols for breast cancer? Option A, breast self-examination. Option B, breast ultrasound. Option C, mammography. Option D, blood test. Yes, 20 members have already answered. What you are thinking, which is the correct option? Whether B.Sc, whether mammography, blood test, breast ultrasound. Here we got the correct answer. 40 members have already answered. 31 members, because already we told you this is multi-select. One is your breast self-examination, one is your mammography. Again, Queen is in the top list. Tiger is same, following Queen. Answer A and C are both the correct answer because most recommended BAC for young age, mammograms who are age of 40 or earlier for high risk patients.
And when we talk about B.Sc, that is breast self-examination, as it was told in the webinar, that one should start doing this. This is very visible method of checking the breast while fifth day or seventh day of cycle. Yes, so you can go on.
Yes, ma'am. Here again you have a double point. What is lumpectomy? Option A, removal of breast and underlying chest wall. Option B, removal of breast and lymph nodes. Option C, removal of cancer cells and surrounding tissue. Option D, removal of entire breast. What are you thinking? Which is the correct option? 63 members have answered. This is really overwhelming. 10 members have answered correctly. You can see removal of cancer cells and surrounding tissue is lumpectomy. Again, jungle queen holding her position. Tiger is following. Removal of cancer cells and surrounding tissue, because lumpectomy is a removal of the cancerous cell and the surrounding tissues. Now we are in the last round, round 3, pivotal role of brachytherapy in cervical cancer. Here is your question, which is having a double point. What is the major cause of cervical cancer? Option A, cervical dysplasia. Option B, cervical polyps. Option C, infected with human papillomavirus. Option D, vaginal bleeding. 30 members have already answered. Those who are watching on Facebook, please do comment in the comment box. Your time up. We can see 31 members have already answered. Infected with human papillomavirus is the major cause. Still, again, jungle queen and tiger is following. Really, to jungle queen, tiger is following. Infected with human papillomavirus is the major cause for cervical cancer. Here is a question with multi-select option. What is brachytherapy? Option A, it is an external radiation. Option B, delivers a high dose of radiation. Option C, placing radioactive source directly. Option D, provides productive outcomes. Your time is running off. Fastest finger first. 30 members have answered. Here we can see, because it is multi-select, we can see here 20 or 25 members have already answered. Provides productive outcomes and delivers a high dose of radiation. Jungle queen and tiger. Now Vidya also following them. So it is a type of high dose of safe radiation therapy, yields positive results also. What are the current emerging therapies in cervical cancer? Option A, targeted radiation and chemotherapy. Option B, immunotherapy. Option C, different types of brachytherapy. Option D, all of the above. 50 members have already answered, but your time is running very fast. Time up. 51 members have already answered. Your answer is all of the above. Now we'll see who is in the top list. Again, queen and tiger. Here the answer is all of the above, because all the options are clinically indicative in cervical cancer. Here is the last question for you, double points. How to prevent cervical cancer? Any idea how to prevent? Option A, safe sexual practice. Option B, regular screening and human papilloma vaccine. Option C, screening of pre-malignant lesions. Option D, all of the above. My God, 66 members have already answered. Time off. We can see the right answers here. Right answer is all of the above. And 39 members have already answered the correct answer. Now we will see who are in the top list, whether jungle queen or not. All of the above, because safe sexual practice, also pre-malignant lesion screening and human papilloma vaccine are essential strategy to prevent cervical cancers. Congratulations to the winner. Now we will see who is the winner. And also join us every Thursday Facebook Live at 3 p.m. for more and more exciting webinars like this. Take a selfie with your quiz group and Yashoda Hospital Nursing Education and Training webinars on your social media. Keep it more interesting. Now we'll see who is the winner. Nursing Pro Quiz, Surgical Oncology Nursing. Vidya is in the third list. Second, Tiger. Now who is, you can judge, you can just guess it who is in the first. It is already expected that jungle queen. Really says jungle queen. Congratulations, Jungle Queen.
So the queen and tiger, they both were playing from jungle, and we need to also explore who is this Vidya. So
We
that
will.
a very quick and very instant webinar quiz that we had just now. Thank you for all your effort, and thanks every Thursday, every fourth or fifth week of Thursday. Do watch us and do download Kahoot before you start the game, and keep us following in Yashoda platform for the excellent new relevant nursing webinar. Thank you. We end the session, and
Thank you
thank
so
you
much.
everybody. And we had some sort of issues, but it was quickly it is solved. And thanks to Pratisha Chaudhary as well, I think, who is doing the back end, and Bindu, I could see her. Thanks to entire education team, including
Thank you.
BPG, Vimla Garuji. Yeah,
Thank you,
thank
ma'am.
you.
Special thanks to Bimla ma'am also.
Yes. Thank you. We
Thank
end
you.
this.